Thank you for joining me on the Save My Thyroid podcast, where I help people save their thyroid and regain their health. My name is Dr. Eric Osanski, and if you have hyperthyroidism, including Graves' disease or toxic multinodular goiter, then you will especially benefit from these episodes. If you have Hashimoto's thyroiditis, you also need to save your thyroid, and therefore you will also find many of the episodes to be valuable. Now, you're about to listen to another Save My Thyroid health audit as I will spend approximately 25 minutes chatting with someone who has a thyroid or autoimmune thyroid condition and give them actual advice to help them improve their health. In this Save My Thyroid audit, I chatted with Jenny, who was diagnosed with Hashimoto's and is dealing with infertility. Now, just a reminder that this audit isn't exactly the same as a comprehensive consultation I do with a patient, as prior to doing an audit, I have the person fill out a brief application, and it's fine if they send a few basic blood tests. Whereas with a patient consultation, I'll have them fill out a comprehensive health history and other forms, and they will usually send a decent amount of labs for me to review. And of course, the patient consultation is a lot longer, but either way, I'm confident that you'll find this conversation to be valuable. Also, if you would like to apply to do an audit with me, you could do so by visiting savemythyroid.com/audit. As usual, make sure you listen to the post episode chat after the outro music, as I'll expand on testing T4 and T3, reverse T3, fluctuating TPO antibodies. I'll talk about vitamin D as well as high vitamin B12. And you can access the show notes by visiting savemythyroid.com/195. Anyway, here's my conversation with Jenny.
Welcome to the Save My Thyroid podcast, hosted by Dr. Eric Osanski. To stay up to date on the latest thyroid health-related topics, make sure to subscribe on your podcast player. And to get your free thyroid and immune health restoration action points checklist, visit SaveMyThyroidChecklist.com. The following discussion is for educational purposes only and is not intended to diagnose or treat any disease. Please do not apply any of this information without first speaking with your doctor. Now let's head to the show.
So welcome to another Save My Thyroid audit. I am very excited to chat with Jenny here, and she's going to talk a little bit about her health journey. And how are you doing today, Jenny?
I'm doing well. Thank you. I appreciate the opportunity to meet with you.
Thank you as well for doing this. I know that we were chatting, of course, a little bit before this, and you filled out the application I have everybody to do just so I could get an idea of your health challenges. And so you were recently diagnosed with Hashimoto's, and one of the biggest challenges, really the biggest challenge, is dealing with infertility. So can you give a little bit of that background of when were you diagnosed with Hashimoto's, and as far as the infertility, you received IVF as well. So if you could talk a little bit about that.
Yeah, certainly. My spouse and I are navigating secondary infertility. So we were able to have one child naturally and then went to try and have a second child and were not able to. So after a while of trying, I had reached out to my OB to get some potential blood work done to see. They look at stuff like your ovarian reserve, your TSH, and something else. And at that point, my TSH was in the normal range, but from my understanding was higher than what they wanted to see for somebody who was trying to conceive or pregnant. And from what I've learned too, that range may not be the most accurate range in terms of TSH functioning. At that point, I was put on levothyroxine and took that with hopes that maybe that would be the magic thing to get my TSH down and then I could get pregnant. Unfortunately, it didn't happen. We eventually got referred to a reproductive endocrinologist. And at that point, did a lot of blood work. And within that, wasn't a full thyroid panel, but was included a TSH again and TPO antibodies, which were high. So that was a little over a year ago. And no one told me you have Hashimoto's. No one said there was really any concern with my thyroid, just said something like, there's just been a little damage to your thyroid, that's all. And it's unlikely that your thyroid is impacting your ability to conceive. So we continued to do interventions and we did several IUIs. They were unsuccessful. We went to do IVF as well. That was unsuccessful, which was, and that's a whole nother topic and it's really devastating. And then at that point, we're missing something here. Something is off. I had done through this process a lot of research on thyroid, my thyroid health, and was introducing supplements, working to get rid of toxins, change my diet, stress management. But as you can imagine, it's really hard when you're doing IVF and they're like, don't be stressed. But it's like one of the most stressful things ever. So I met with a endocrinologist this summer, and pretty off the bat, she was like, you have Hashimoto's and mild hypothyroidism. And I also recognize too, I have a family history of that. My dad actually has Hashimoto's. My paternal grandmother, I don't know if she was diagnosed with Hashimoto's, but there was issues with her thyroid and she had like a goiter. So I'm pretty sure she had Hashimoto's. And at that point, just went into a deeper dive on like, okay, I got to figure this out. What can I do to support my thyroid? And consulting with some of your work, some other folks and their work as well.
Is that when you did your research? Is that how you came across me? Did you come across my website or my book or?
I came across your book, website around the time when I did that blood work, when I was initial blood work of difficulty conceiving with my OB. And they were talking about thyroid. And I was like, okay, my mission was to have a baby. I got to do everything that I can. And my dad, I think, was the one that pointed me in your direction. He has an extensive library of thyroid books and resources.
Glad he found me and referred you to me. And TSH. So when they first tested TSH, it sounded like it was within the lab range, but just higher than optimal. Like they didn't look at the thyroid hormones. They just put you on the levothyroxine just based on the TSH alone. Eventually, they retested the TSH. Again, it sounds like they still didn't retest, like they didn't do a thyroid panel, just look at the TSH and did the TPO antibodies. And then they saw that the TPO antibodies were high. Do you know if they tested the thyroid globulin antibodies, which are also associated with Hashimoto's? Or
No, I don't. I don't have any blood work of that. I haven't had a full panel done. I had asked my endocrinologist about that and got met with just looking at the TSH and TPO antibodies and didn't feel like we needed to test the T3 or T4. From some of my more recent research, and maybe this is to a question with you, I'm hoping to do a bit more advocacy for myself to try to get a full panel done. I just feel like that would be helpful, even if they're not considering it in their side of things, just for me to have an understanding of where I'm at, and also with a strong desire to reduce my antibodies.
so when it comes to testing thyroid globulin antibodies, I could understand why they're not doing it because it won't change their approach. They're going to give the thyroid hormone replacement regardless, the levothyroxine. But I think it is crazy for them not to look at the thyroid hormones just because maybe you're taking the levothyroxine, which is T4, but T4 has to convert into T3, and it's not always reflected with the TSH. The T4 influences the TSH more. And so for all we know, the T3 might be on the lower side, even if the TSH is looking better with the levothyroxine, and T3 being the active form of thyroid hormone. If that is on the lower side, that definitely can affect conception. So yeah, if you can't get it through your doctors, I would just pay out of pocket. I realize you've already spent who knows how much money on the IVF and all that, but for like $30, depending where you go. If you go to some walk-in labs, they might charge you like 3 times that amount, or like over $100. But if you shop around, you could get it for like $30, $40, a full thyroid, or at least TSH, free T3, free T4. So not like a full thyroid panel with antibodies, but at least look at the thyroid hormones and make sure that T3 is optimal. Because I do see a lot of people with Hashimoto's where that T3 is on the lower side. So definitely want to look into that. Like I said, the thyroid globulin antibodies, for the sake of what they do, I could understand not testing. But actually, on the podcast, I interviewed a few healthcare practitioners, talk about fertility, also based on my own research too. Like when you have low thyroid, that could affect conception, but then the antibodies could also increase the likelihood of having a miscarriage. It doesn't mean obviously you will have a miscarriage, but so it's nice to get those antibodies tested to see. Maybe you just have the TPO antibodies and the thyroid globulin antibodies look fine. And if that's the case, you won't need to necessarily retest those again. But if they're both high, And if the goal is to eventually normalize them, that which is my goal when working with someone, then yeah, I would say it's a good idea to eventually retest it, but test it, not retest it because you haven't tested it at all yet. But priority would be the T3 and T4. And then again, same thing. I mean, if you absolutely had to, you could pay out of pocket for the thyroglobulin antibodies as well. It's unfortunate that most doctors, including endocrinologists, will just look at a TSH, and some will do a TSH and T4. But as I just mentioned, that conversion, you do want to see, make sure you're converting T4 to T3. You might have heard of reverse T3,
Yeah.
which sometimes could be helpful too. But like I said, I realize you've already spent a lot of money. Reverse T3, again, some, including some people I've interviewed, really think highly of it. Like everybody with Hashimoto should get reverse T3. I do try to include it, but to me, it wouldn't be like the priority. Like when we prioritize the blood test, again, TSH and thyroid hormones are the priority. Antibodies are important. Reverse T3 kind of on the back end. If you can get that done, great. If you can't get that done, usually we could look at the other numbers and get a good idea what's going on.
And if my T3 is lower, is that when there would be the recommendation would be to shift what medication I'm on?
Yeah. So if you're having a problem converting T4 to T3, I mean, ultimately you want to try to address the cause of the problem. But while doing that, you might choose to take T3. So there's a few different options. They probably would recommend synthetic T3, like something like Cytomel. There's also desiccated thyroid, but a lot of doctors aren't big fans of that, especially during pregnancy. Things like Armor, NP Thyroid, which have T3, T4, also T1, T2, which is less well known. But they probably would recommend synthetic T3, or another option is compounded thyroid hormone, where you go to like a compound pharmacy and get T4, T3. But you would want to also address the cause of the problems. Approximately 60% of the conversion of T4 to T3 takes place in the liver. Another 20% takes place in the gut. Sounds like you've already done some good things for your health, like working on the diet. And I mean, stress also could affect that conversion. Having higher cortisol impact the conversion of T4, T3. So if you have to take the T3 to help with the conception, that's fine. But you want to also ideally work on, try to identify the cause of the conversion problem and then address it.
Certainly. And that's where I feel like I'm so close yet so far away at the same time of figuring out the root cause. Like my TPO antibodies went up by like 400 over the last year. And I thought I was doing all the stuff I needed to do to help to support my thyroid. And granted, I was under a high level of stress. I was taking a lot of medication for infertility reasons, and they were working to reduce inflammation, but I still had a lot of inflammation too happening because of all of that. And yeah, it's just, I was really disheartened when I asked to get my TPO antibodies rechecked recently, and was just so disappointed when I saw they had increased by 400. And I was so hoping the opposite.
It can be challenging to lower and normalize the antibodies, and it's not uncommon for them to roller coaster back and forth, which could definitely make it challenging. The opposite, like let's say you test antibodies again in a few months, and if they decrease greatly, again, sometimes it could be misleading. Obviously, that's what we ultimately want to see, but it sounds like something might be missing. So diet and lifestyle, very important, but it's a piece of the puzzle. So if you have my book, Hashimoto's Triggers, there's a lot of different triggers. Food is one of them, stress is one of them, but there are a lot more. It could sometimes take some extensive detective work depending on the person. But I guess that's the next question. Have you done any functional medicine testing at all? Hey, this is Dr. Eric. And if you're looking to do everything you can to save your thyroid, in addition to listening to this podcast, there are a few different ways we can help you. First of all, I've written 3 books on thyroid health, 2 related to hyperthyroidism and 1 related to Hashimoto's, and you can get all of them on Amazon, or to learn more about them, visit savemythyroid.com/thyroid books. Second, you can also join my Graves' disease and Hashimoto's healing community by visiting savemythyroid.com/thyroid group. And finally, if you want to get personal help from me, you can visit the website workwithdreric.com. Just to let you know, I only see a limited number of new patients each month, and I do require anyone interested to complete a brief online application before working with me. And now back to the show.
No, I haven't. I haven't done any functional medicine testing. I'm interested in that. I was in such a urgency to have a child and wanting children close together, and really got pushed in a variety of directions into more of the medical route. And I do feel like that would be beneficial for me, and I'm hoping to do that. But on my own, I've really worked on like and you were speaking to this, I recognize there's more than just the lifestyle, but working on the foods I'm eating or not eating. One big thing has been balancing my blood sugar. I was always super, what would they joke, kind of like hangry person. And I feel like that's gotten a lot better. I'm taking a lot of supplements, and some of that is good. Some of that is frustrating. I don't want to move through my life taking this many supplements. Some of them I don't even know if they're doing anything or not, but either they were recommended for infertility reasons or suggested in some thyroid resources I found. It's like stress management. I feel like my gut, I've had gut issues throughout my life. They're a lot better now. I don't experience that as frequently. I mean, here once in a while, but I feel like I've had a lot of growth there. I have no idea how my liver is doing. I know that the liver functioning is important, and there can be a lot of buildup there, but I wonder about that. I feel like I'm going off from your initial question was about functional, and here I am telling you all the things that I have tried to do so far. So I'll stop here.
Yeah, no, that's okay. Getting back to the liver, when you do a basic blood test, like a comprehensive metabolic panel or a hepatic panel, they're just looking at liver enzymes, AST, ALT, sometimes called GGT. Just that doesn't really look at the function of the liver. So if those levels are low, that's what you want, which if they're higher, that means that there's some type of damage taking place. I see that more with my hyper patients when they take antithyroid medication, for example. Something like the levothyroxine wouldn't do that, but it doesn't really tell us how you're detoxifying, what your toxic burden is. That's a challenge just because there's really not a great test to look at our toxic burden. You could do testing to look at heavy metals, and you could do other tests to look at other types of environmental toxins. But in that respect, I would say definitely do as much as you can to minimize your exposure to environmental toxins. Some people will do, even without knowing levels of heavy metals and other environmental toxins, they might do liver detox, and that's usually harmless. It's sometimes it could cause certain side effects like die-off effects. But the supplements, I definitely recommend supplements, but that's one reason I do the testing. There are some general supplements like commonly given omega-3 fatty acid, probiotic. It depends on the person, but we want to do testing to see what imbalances someone have. My guess is you probably had at least some blood testing like vitamin D. I'd be surprised if they didn't look at your vitamin D levels.
I did have vitamin D, and that's fine. I've had vitamin D, iron, B12, magnesium.
How did your iron look? Because you also, another challenge is hair loss, which could be related to the thyroid, but then also nutrient deficiencies. I don't know if you remember your iron numbers, because a lot of times they're less, kind of like the thyroid. They might be within the lab range, but outside of the optimal range.
I don't have the specific numbers don't come to mind, but I believe it was fine, but within the lab range. But also I had some resource that I was also consulting more functional medicine, and it seemed like it fell in that range. So that wasn't a concern. My B12 was really high.
Yeah, especially if someone, I assume you're not a vegetarian, that you eat meat or.
Yeah, I do.
So if you ate a meal higher in B12, like whether it was beef or something else the night before. I mean, if you're taking a B12 supplement, which maybe you're not, or you're probably taking a prenatal, you said you're taking a lot of supplements. Are you taking a
Mhm.
prenatal, which has not only folate, but B12?
Mhm.
Yeah, I usually don't get too concerned when I see B12 high because it is common on the blood test. When it's low, that could be an issue. When it's high, it's usually because you're getting exposed to it either through the diet or supplementation. There's another marker called methylmalonic acid, which is a better indicator of B12 status, usually not tested by most doctors, but that might be something to look into if you're concerned about that. with the diet and lifestyle, what you're doing, that as far as eating, trying to eat a whole healthy foods diet, again, the stress is huge. So I know you're doing things to manage your stress, but I would just continue on an everyday basis. It doesn't mean that you have to spend like an hour per day on stress management, but I think consistency is important because some people will maybe do yoga 2 or 3 times a week and that's it. But you really want to be in the routine of stress handling. And how's your sleep at night?
My sleep is generally okay. That's one of the areas that I'm more recently been focusing on. I have to acknowledge I didn't sleep as great last night because I was a little nervous for this conversation and being recorded. Found myself waking up thinking about what I was going to say. But generally, I can fall asleep fine. I do think with balancing my blood sugar, at least a piece of it has supported me in waking up not as groggy. I don't know for sure, but I think just energy wise, I'm feeling a little bit better. But I do have a Fitbit that tracks my sleep, and I'm always have like a very high level of light sleep and not much deep sleep.
Okay. Well, a lot of light sleep and not enough deep sleep. Okay. So, yeah, it's something also to work on. You haven't had your adrenals tested, I assume?
No.
Also, something to look at. There's a few options with that. Saliva testing is really good with looking at adrenals, but a lot of functional medicine practitioners would recommend Dutch testing if you're familiar with that for someone who's struggling with fertility, because that looks at adrenals, looks at sex hormones, but also looks at the metabolism of the hormones as well as some other things. So that might be something in the future that you want to look into. You've heard of Dutch test?
I've heard about it. I don't know too much about it. The name is familiar to me.
Especially if someone is focusing on fertility. Most practitioners of functional medicine recommend the Dutch test. Not everyone. Some might just recommend saliva testing for adrenals and testing sex hormones in the blood, which the thing is, you can't look at the metabolism of the hormones in the blood, but still, it's not like I can't say Dutch test is absolutely necessary, but the more information you get, the better. I would look into that. You've already done some tests, like you said, through the blood. You mentioned the iron, the B12, the magnesium. Magnesium in the blood, a lot of times they look at serum magnesium, RBC magnesium is better than that. But sometimes you got to take what you could get if you go running it through insurance and all that. So I understand that. And then you mentioned the gut. So you said the gut used to be a big problem, but not as problematic. So again, maybe you don't need to do gut testing like a comprehensive stool panel. You could always start conservatively, but it's really up to you. I mean, some women, understandably, especially if they've gone through IVF and they want to do everything they can. So I tend to be, on average, more on the conservative side with the testing. Not to say you need to spend thousands of dollars on functional medicine testing, but in this situation, since you did have a history of gut issues and you can't always go by symptoms, you might want to dig a little bit deeper. If you do decide to do functional medicine testing, maybe consider the Dutch and a comprehensive stool test.
Yeah, I would be open to that. I wonder, right, if there's still something there because it was so bad for a large chunk of my life. And I'm grateful that it's better. It was really impactful in my life. And that's what prompted me to go. Like, I've been gluten free for 14 years. So that was what helped me a lot. Still didn't resolve it all, but helped a lot. I would be interested in doing a kind of comprehensive stool panel.
Yeah, I think really the next steps, continue with the diet. Gluten free is great. I usually recommend paleo or autoimmune paleo for Hashimoto's, but even like paleo, if you're concerned about AIP being too restrictive, paleo is still pretty healthy and it eliminates the common allergens, the refined foods and sugars, the unhealthy oils. Again, the stress management we spoke about, just continuing to work on sleep, reducing a toxic burden, try to minimize at the very least cleaners, cosmetics in your home, try to eat as organic as possible. And then, yeah, the functional medicine testing just to fill in the gaps. Because if you feel like you've done everything from a diet and lifestyle standpoint, and again, maybe you haven't, maybe you still, there's some still improvement in that area. But even if you have done 100%, you want to make sure that everything goes according to plan with conceiving. I would recommend doing the functional medicine testing. Like I said, some type of adrenal testing, maybe digging deeper, doing the Dutch test, possibly comprehensive stool tests. So yeah, that would be your homework to things to work on. And yeah, hopefully you give me an update in a few months with some really good news. Again, it's not easy. I know it's very stressful, very emotional, even for those who aren't having fertility issues, taking a functional medicine approach and trying to lower and normalize antibodies, usually not an easy process. So I commend you for doing what you've done so far, but I definitely would look into the functional medicine testing and definitely give me an update in the future.
Thank you. I will definitely look into the functional medicine testing, and I hope there's a good update. And at the very least, I want to be able to just be the healthiest version of myself and reduce some of these other symptoms that I have. And if there's a baby, that would be beautiful. But yeah, I hope there's an update for you.
Well, hopefully you get the best of both worlds where you optimize your health and you give good news of pregnancy and then, having a healthy baby and all that good stuff. But yeah, so I think the good news is that there's still things that you could do. It's not like you've exhausted everything. If you said you did all the functional medicine testing, and again, even I think diet and lifestyle, there's room for improvement. So I think you can continue to work on that, consider functional medicine testing. And yeah, I'd like to be optimistic and confident that in a few months, you'll shoot me an email with some good news. So definitely do so. And again, thank you so much for agreeing to do this audit, Jenny.
Yeah, of course. Thank you for your time and speaking with me.
And thanks, everyone. Thanks again for taking the time to listen. I hope you found this conversation to be valuable. And I look forward, of course, to catching everyone in the next episode.
Thank you for listening to the Save My Thyroid podcast. If you haven't done so already, make sure you hit subscribe to stay up to date on the latest thyroid health-related topics. And to get your free thyroid and immune health restoration action points checklist, visit SaveMyThyroidChecklist.com. Thanks so much for tuning in.
All right. So hopefully you enjoy this conversation I had with Jenny. Again, diagnosed with Hashimoto's, dealing with infertility. She did have one successful pregnancy that was natural. And so her TSH was above the optimal range. And so she took levothyroxine, which didn't help. She also mentioned TPO antibodies were high. I don't think she tested for thyroglobulin antibodies. And then IVF wasn't successful. And she does have a family history of Hashimoto's. So first I want to talk about testing for T4 and T3 because they only tested for TSH. And so still it's amazing that there are doctors out there that just look at TSH and won't look at really a complete thyroid panel, looking at T4, T3, thyroid antibodies. Now reverse T3, I did mention how it's lower on the priority list. And I mean, for hyperthyroidism, I almost never test for it because we expect it to be elevated. Hashimoto's, I do like testing for it, but even in this case, it's usually not a priority, I would say. It's not one of the top tests. But if someone's on a budget, I won't say they absolutely need to get reverse T3 done. If they can afford it, I do like looking at it. So yeah, reverse T3 would have been great, but at the very least, T4, T3. Just like I said, it's absurd that they just looked at TSH. And then fluctuating TPO antibodies, quite common. And while the long-term goal should be to lower and normalize the antibodies, it's very common to see antibodies fluctuate, especially TPO and thyroglobulin antibodies, but sometimes TSI, thyroid-stimulating immunoglobulins for those with Graves as well. It doesn't elevated TPO antibodies doesn't mean that things are getting worse necessarily. So if your TPO antibodies were 200, and then your next test showed it was 600. I mean, this is, you could say it's not good, but one test, I don't get too alarmed. If it like jumped from 200 to 600, one test, I wouldn't be happy, but I would want to see what the next test after that. If the next test jumped to 900, then yeah, then again, I don't like that. But sometimes I see where it jumps, in this case, let's say to 600, or go down to like 300 and kind of roller coaster back and forth, and might do that for a while. So she hasn't done any functional medicine testing. So I mentioned that would be a good idea to try to address the underlying cause. Stress, sounds like stress is a big factor. And of course, is a big factor with a lot of people. A lot of people need to block out time to manage stress. Used to have gut issues, but she said it's been better. Going gluten-free has helped with her gut issues. Vitamin Z. So vitamin Z, I wanted to mention because Jenny said that they were fine, but I didn't ask her what the levels were. They might have been outside the optimal range. So just because they were fine within the lab range, don't mean they were truly fine from a bone health perspective, maybe, but from an immune system perspective, you want them to be at least 50, over 50. If you're overseas, you might use a different units like nanomoles per liter, and that you would want it to be 125 at least. And then also, she mentioned high vitamin B12, which I mentioned is very common, especially if someone is not a vegan vegetarian. So if you're eating foods high in B12 and or taking a supplement that has B12, she was taking a prenatal. I also mentioned methylmalonic acid as an alternative test, and that's especially urinary methylmalonic acid is a better test. It's just that many medical doctors won't look at methylmalonic acid, but if that's elevated, that typically indicates a B12 deficiency. And so that pretty much is it. Again, just enjoyed the conversation and hope that she digs a little bit deeper, does some functional medicine testing. Definitely think there's a good chance she can conceive again, but just going to a regular doctor, conventional doctors, and even the IVF route. Again, that does work for a lot of women, but for a lot of women, it doesn't work as well. And so, of course, I'm going to be a proponent of trying to find and address the underlying cause of the problem. And so hope you found this conversation with Jenny to be interesting and helpful. And of course, I look forward to catching you in the next episode.